Without your love, I want to make you happy. Yes, my people, I'm still here at work. It is 9:10 right now. It's 9:10 right now in Kenya, and there are some questions that had been asked by the people. Several questions that I've been asked by the people to answer about autism spectrum disease, and I thought I could come at 9 and answer them. Autism is, today we learned so much, and we learned about how it starts from the brain, how autism starts from the brain, and how the brain is affected. So everyone has come in. Welcome to the chat. Welcome to the chat. Welcome. As you come in, tell me where you are from. Tell me where you are from, and let's interact, my guys. Let's interact. You know, when people have asked you to talk about something, it means it is bothering them, or there is a percentage of people that are affected by the same problem. So autism is we say it's a spectrum of disease, whereby now that we have discussed it, I say autism is a spectrum of disease that affects the endoderm cells when they are going to create the neural tube. Neural tube. When endoderm cells are going to create, you know, mesophyll, basophil. You understand the process that we discussed today. So when the neural tube is being formed and then there is destruction of the neural tube, you end up having problems in your brain. When you end up having problems in your brain, we come up with a condition that is called autism. So I'm just bringing out what we discussed today about autism. It may be genetic, it may be you personally, you brought that condition, because we saw autism can be genetic. There are some people that are born with mitochondria that in the cells they are not producing enough. They are not producing enough energy for the cell to migrate inside to form the neural tube. If you are new here we talk about, welcome Kingre. Here we talk about medical issues. Benjamin, the wise guy, the doctor, and we were talking about autism today. Alimig, hi doc. Alimig, today we were talking about autism. So right now we are answering the questions that I have been sent by the people. So if you are new in the house, subscribe, hit the like button. So we saw how a baby is formed right from conception, day 1 to 4, day 4 to, if you've not seen that video today, please go and watch it. So right now you understand that autism does not start when a child is born. Autism starts from conception, when the sperm fuses with the ova, and then it is implanted. Where is that? Where it's implanted, and then when it is implanted, there is a ball. Let me see. When the sperm fuses with the ova, it forms a black round ball, and then cells starts to form, and then it is implanted in the uterus. So autism starts from this stage, the formation of the ectoderm, mesoderm, and endoderm. So the ectoderm, when it is fusing to go in, when it is fusing, and then it gets interruption, that's where autism starts, here at this stage of fusion. If you have not seen that video, it's important you check it out. Tomorrow we'll be continuing with the diagnosis of autism diagnosis, but right about now I have to get going by answering the questions that I was asked. I've been asked several questions, and I want to respond to those questions right now. And if you have even a question about the spectrum of disease, you can ask. Now that we understand autism does not start when the child is being born, it starts when the child conception. Life starts at conception, when you make love, and then the sperm fuses with the ova, and when the sperm fuses with the ova, at the stage of forming the ectoderm, when the ball itself has been implanted on your uterus, on the uterus muscles, when it is forming the placenta, when it is forming the veins. Now, Adele Mosa, I know you are unable to identify any type of material. This is also very obvious. Adele also has a problem. So if you are new, tell us where you're coming from. Chat is open, and if you have not subscribed, please subscribe to the channel. Give me a like. We were on the autism spectrum of diseases for those that have been here since we started. So I want to go through the questions that have been asked. There are several questions that have been asked, and there are questions of importance about autism. So the point that I want you to take home are, autism does not start when the child is born. No, autism starts from conception, when it is the ovary is implanted to the uterus, and then the stage where the layers. I am Chris. Hi, doctor. Said, I'm Chris. I'm fine. I'm answering questions. Thanks for landing in. I want to answer questions about autism. Even if you are, others believe your knowledge, don't have change what you actually do. Adel Mosa, you are nuts or what? Okay, and Sumana, I'm answering questions about autism. So the point that before I start answering these questions, I want you to understand that autism does not start when the child is born. No. Autism starts when conception happens. You get? Autism happens when the sperm and the ova have fused, and it is the stage of forming the morula, and the cell, the blastocyst, has implanted, and now they're differentiating, and the cell is moving down to form a neural tube, so that you can now start forming the brain, the hands. The child is growing now. And that is a very important stage. And what did we say it brings? I'm revisiting what we did. What can bring autism? 1, nutrition. Okay, there is someone who is texting. You will be banned. And then most if you continue texting things that are not identifiable, or you will be banned. Now, things that can cause someone to have migratory problem of the neural tube when it comes to autism. Infections, mostly viral infections, and we saw toxoplasmosis and rubella. Rubella viruses, they can cause a problem when it comes to migration of those cells to continue forming the brain. Okay, genetics. There are some proteins that are signaling proteins that they tell the cells, now start going in. We want to form the brain. And then you have a mutation of those proteins. The slowness of creation of the brain leads to a brain that is dysfunctional. Another thing are alcohol and drugs. So when a woman is pregnant, alcohol and drugs can be a problem. Another thing will be what? You don't need to agree with me, no worries. There is someone who is really texting. Adelmosa, now you stop that. Now, another thing is nutrition. We said about nutrition. Okay? So those are the things that cause a lady to give birth to a child who is autistic. And these things may be genetic or lifestyle that you are undergoing. So the questions that have been asked, have been sent and asked today are these ones. What is autism spectrum disorder? What is autism spectrum disorder? Then BGP. BD, how are you feeling? How living? Oh, I'm fine. I'm fine. BDGP, I'm fine. I'm responding to questions of autism. So BDBGP. Okay, welcome. Subscribe BDGP. You subscribe and follow us. Subscribe and follow us. Like the channel. See what we are going through. Check the playlist and see what we discuss. Right now, I'm answering questions that have been sent of autism. So someone asked, you did a very good BDBGP. I'm Chris. Hi. Okay, you did a very good presentation about autism, and now we know it doesn't start from when a baby is born. It starts from conception. What is autism indeed? Autism is a neurodevelopment condition characterized by 1. Difficulty in social interaction, problems with communication, present or restricted or repetitive behaviors because of the problems with the cranial nerves. When the neural tube is forming, and then you find that you get something injures the cells, and then they destroy the nerves. So depending on where the nerve is destroyed or the brain is destroyed, then you got autism. That is what I can say what autism is. The person who asked, I think, will watch, or you are watching, what is autism spectrum disorder? BDBGP, where are you from? Which country are you from? BDBGP, which country are you from? Tell us as you subscribe to the channel. Tell us as you subscribe. The US. Oh, nice. That is good. Welcome to the channel. Here we talk about medical issues, mental health issues, and then we have the session that we listen to music, we interact, and we feel good. If you check on the playlist, you will see what we do. It is called Feel Good Evening. So you are welcome. Subscribe and like. Give you a like. And also, I have friends in Arizona. You will meet them here, by the way. You will meet the friends that are from Arizona here. I have a very large follower that comes here and say that they live around Arizona. Okay, let's continue. I've said, if I was asked what is autism spectrum disease, this is a neurodevelopment condition characterized by difficulty in social interaction, difficulty in problems with communication, and restricted repetitive behaviors. You get, it's called spectrum because symptoms are wide. It's not one symptom, they are wide symptoms. And that is the first question I was asked. There is another question that I was sent that was asking, what causes autism? You see, and that question I've just answered it. You get, when my introduction I was giving the introduction, I just answered it. Genetic mutations, drugs and alcohol, you get, nutrition, nutrients like micronutrients like folic acid. You know, folic acid, when women are pregnant and they take folic acid, what do? They are giving themselves DNA proliferation, because folic acid is created by the DNA is proliferated. It's like folic acid is like fertilizer of the DNA. You get. So when women are taking it when they are pregnant, you know, very many things are going around that time, the first trimester. They are helping the baby to grow well and the DNA to proliferate. You get. So that is the causes. Those ones have dealt with them right from the beginning. The cause of autism starts when the implanted cells at 14 days are destroyed, when the neural tube is being formed, so that you can. Hi sis, I see you are here, sister. Welcome. Today I was talking about autism, and I've got so many questions, so I'm answering some that I got today. Hope you are you still in Finland, or you are back in Norway? Hope you made us good videos to enjoy. I hear about Finland, I see flowers. So hope you made me good videos of flowers I enjoy. Now, it starts from the neural tube development. You have seen those structures that I drawn. So, yes, I'm in Finland. Nice. Do good videos. We are talking about autism. I'm answering questions about autism. So, abnormal development of the brain, especially during fetal life. And you have seen, if you've not seen that today's video at 4, please go and see it. I've explained how a baby forms, how the cells migrate inside, and then the hand comes, and then the brain forms. You get? So one of these stages, the brain can be injured, and you start having problems. You get? And environmental issues like infections, maternal infections when you are pregnant, and toxins can cause that. But early stages, the first trimesters of the first month, when the cells, ectoderm cells, are moving in to form now the spinal cord and the brain. You get? That is where where the problem starts. What causes autism? That is a very important question. But now, as we interact, at least you understand and you know what causes autism. Several things that can cause autism, you understand them. At what age is autism diagnosed? That was another special question. At what age is autism diagnosed? You know, an autistic child you cannot diagnose when you are going to ANC clinic, because this child grows normal in the stomach, everything is good. You do an ultrasound, you do an echo, a fetal echo, everything, the heart is okay, the heartbeat is okay. But when this child is born, you realize there are some problems. You realize there are some problems that are coming out. So at the age of 2 to 3 years, it might be diagnosed, but early signs appear between 12 to 18 months. When now there are some things that are called reflexes, moral reflexes of the baby. When this baby is growing, it starts to do what? To signify themselves, the reflexes themselves. You get? So you get to understand that this child is not depicting some things that are normal, that the child should be. When you tell this child to gasp, he's not gasping. Moral reflex is suckling. Sometimes when you touch at the palm here, you get he's not doing this. You start knowing there is a problem. That is between 12 to 18 months. And then there is usually diagnosed between 2 to 3 years. But early signs, they start between 12 to 18 months. When you start noticing there is a problem that is going on. You get? Now, we continue. That was a question that was... These questions are the ones that I was sent to talk about. But tomorrow I'm dealing with diagnosis. That's why I'm bringing them right now. Usually diagnosed between 2 to 3 years. Now, let's go to what are early signs of autism. Another question. How can you know that this child is autistic at an early age like 12 to 18 months? Always no eye contact, because you will see that maybe when the neural tube was being developed, the way we discussed, at the high centers of the development of the neural tube, there were some cells that migrated. So, like you see, we talked about the 12. If you have not watched today's video, please go and watch. We talked about the 12 cranial nerves. So, if a nerve like trochlea, optic trochlea, and trigemina, the three, were disrupted, this child's eyes will not function well. You get? Those are nerves that arise from the brain. You get? Delayed speech or no speech sometimes. No responding to names. lack of social life. This child is always alone. Repetitive behaviors like hand clapping and rocking are always seen. You get, there are some things that you notice to this child that are not normal. That is how at 12 months, at 1 year, things that you expect a normal child to be doing, you see that there is delays. We call them delayed milestones. You get? And laughing sometimes, making noise, crying, swallowing becomes a problem. But these things are, if you take an early, if you start taking this child, take an early precaution, take this child to hospital, they may improve. You get? Those are just the questions that I was being sent today after I did the autism. And I said, for you to understand autism, we shall start on how the cells, the sperm and the ova, they fuse, and then they start forming the baby, right from the cells. So I explained right from the cells, the ectoderm, endoderm, mesoderm, when they are fusing inside, and then they are forming the brain and the spinal cord. That is where autism starts. What are core symptoms? The symptoms that show that this is autism. The triad. We have 3 things, important things that show this is autism. This one is autism. What are the symptoms? Social communication impairment. There is a way that you check on your kid. When the kid sees the mother smiles, when you give the kid to someone else, the kid responds like he doesn't want. You get those interactions the kid doesn't have. Language and communication problems when this kid is growing up. The developmental milestones are not there. You get restricted repetitive behavior. Yes, Onik, welcome. Welcome to the platform. Hope you are doing good, Onik, where you are. Welcome to the platform. Welcome. You see, restricted and repetitive behaviors. And those behaviors are not normal behaviors. You get, these are the signs and symptoms that shows a person that this person is autistic. Mostly when it comes to developmental milestones. I know you have seen, about developmental milestones, and you attest sometimes milestones are slow by slow. And as a child who grows, you will always understand this child is growing in the normal milestones. You get? Now, let's go to another question that I was asked. So the main symptoms you have said is communication impairment, language and communication problem, social communication, language and communication impairment, and restricted repetitive behavior. What are the levels of autism? The levels of autism, the normal ones, and I'm repeating, the normal ones that people understand, the normal ones that people know are 1, level 1, need support. Level 2, which is moderate, needs substantial support, and level 3 needs total support. Total support, that is severe. So it is mild, moderate, and severe. We will talk about them as we continue. And then we have, can autism be cured? Someone asked it when we were talking about autism. Can autism be cured? You have understood that it has come from neurodevelopmental cells that are displaced, are destroyed during the formation of a child in the womb. When you are still, it is still cells, blood cells. Can it be cured? That is the question. Can it be cured? No cure exists for autism. By symptom can be improved by early intervention, behavioral therapy, and educational support. Some support that you can get. If you are new to the house, please subscribe and tell us where you are. I can see some people today are new and are just watching. Some are watching, going out, coming in. Here we talk about medical issues and we interact socially. And we do what? We talk about everything that is affecting the health of a person, including mental health, So don't feel free to ask any question. Feel free to ask any question and interact with the people on the chat. Now, let me ask one question. What do you think you yourself about autism? Or what myths have you heard about autism in your area or around where you live? Tell me. Now, can autism be cured? We have said no, but early intervention and behavioral therapy and support can help. You get? And educational support. Now, let's go to how is autism diagnosed? It is diagnosed by developmental history, behavioral observation, and there is something that is called DSM-5 criteria. It's a book that was sat down. Then it's a book of mental health. It's a book of mental health that people sat down and discussed, professors of mental health, and discussed and documented these conditions, brain condition, autistic condition, you get. And then they said this is the criteria of diagnosing the spectrums that are not, wait a minute, just a minute. Butterfly Island, I see you here. I see you. Welcome. I'm answering questions upon autism spectrum disease. There are some questions that are coming in my email, so I'm answering questions now. Welcome to the chat, Butterfly. Hello, all nice topic. Okay, now I'm getting another question here. These are in the email. I'm getting another question here in the email, and let me see. Let me see what they are saying. If you have a question, even right now, you can ask the question. So, okay, DSM-5 means the Diagnostic and Statistical Manual for Psychologists and Counselors when it comes to mental health issues. So we are talking, autism is one of the mental health issues that we have. Autism is one of the mental health issues that we have. So we continue, and we see here we have another question. These questions are coming to my email. That's why you see I'm kind of opening each email to read. Okay, someone had asked, what are the tests done? To diagnose autism? There is several tests: physical, development assessment, like milestone, and then we have genetic testing. If you see, when we were talking about autism, we talked about the genetic problems like mitochondria, and we talked about another thing that was called the mitochondria having less ATP production, and then we talked about the other thing, the proteins of signaling. Some people are born with them that are not working correctly, so we can test those to find out if there is a problem. Genetic testing, hearing testing. So the one who has asked that is another thing. And then we have what conditions are associated. I'm opening on emails that have been sent today after that topic. What are conditions associated with autism? Conditions associated with autism, because it's a spectrum of diseases. What are the conditions that are associated? what can someone have associated with this complication? You get, there are some things that are associated with autism, and these things are like epilepsy. You know, when the brain is injured, there are some things that can show. It depends with where the brain is injured, and you saw from the development of the cells when the brain is developing inside the womb of the mother, the first month, it affects the brain. So the injury of the brain can bring epilepsy, convulsions, attention deficit disorder, ADHD, hyperactive disorder. You get, those are the conditions that can come through. If you are watching and you have a question, don't fail to answer. Just ask your question, I'll answer. I'm reading the questions that are coming from inside my email that were brought by some of us when I was doing this. Okay, anxiety disorders, that is another complication that can come when you have autism. And sometimes intellectual, you know, the brain has higher sensors of IQ. So you may find some people have high IQ or intellectual disability, low IQ. So it depends. Can autistic children talk? It depends with where the brain was affected. Some develop normal speech because maybe the center where the cells were affected, they became normal over time. You get? And now this child starts to speak. Others have delayed or absent speech because maybe when the neural tube was being formed, the center that produces speech of the brain, what happened? Like let's see, we talked about the cranial nerves, hypoglossal, the glossopharyngeal nerve that moves the tongue. If it is affected, this child cannot talk because it controls and innervates even the throat. It is the cranial nerve number 12, glossopharyngeal. You see, so these are the things that and just to come up because of that question, the question that have been asked about autism, the one that says, let me open it, can autistic children talk? You see, I go back to the cranial nerves. Cranial nerves means nerves that come from the brain and they innervate they control your system. Olfactory, optic, oculomotor, trochlear, trigeminal. You get abducens, facial nerve, and then we have glossopharyngeal, we have vestibulocochlear. You get, we have the vagus nerve, and then we have the one that we said is called glossopharyngeal, the 12 cranial nerve. Vagus accessory, the one that moves, shrugs the hypoglossal for the tongue. You see, it depends with where they arise from and where it is injured. That is where we say this child is autistic but cannot do this because that nerve is affected. So when you are testing, you can do an MRI and see a center of the brain that is not working correctly. You who is watching here, please don't fail to answer a question. So some develop speech over time, others have delayed or absent speech. Some have absent speech, some may have alternative communication because now the centers of speech have been destroyed. Someone asked, even that one has just come in a minute ago, is autism hereditary? Yes, it is strongly genetic because look at this. A child is being born, and you know, when you are making love and exchanging the sperm to the ovum, maybe the father's sperm, they have a problem of producing cells that the mitochondria, you know, in a cell, what gives energy is the mitochondria. Those mitochondria, they are not producing enough energy for the cells when they are being implanted to form a good neural tube. So the delay because of energy brings a problem. Or the signaling proteins that signals and tells the endoderm cells, now start moving, go inside, form the head, form the brain. The signaling protein of this person has a problem. Those proteins, they are mutated just like in cancer. So you will find that those signaling proteins are low, and when these signaling proteins are low, what does happen? The neural tube formation, now to start forming a baby, does what? Slows down, and the cells are left behind. So your brain the brain of the child does not develop further to a normal brain. You understand? It develops to something that is not compact as a brain, and it leaves some things behind. This one is also seen in bipolar disorders and schizophrenia, because bipolar disorders and schizophrenia, if you see people that are in families, most families, you will see if there is a person with autism, look at the hereditary gene, you will see somewhere in their family they have someone who is bipolar or schizophrenic. They go hand in hand, you get, because of the development. When the brain is developing and it is injured, it does what? The serotonin, the dopa, the gamma balance does not go well, so the brain does not. So it is genetic. For the person who asked, that one is hereditary and it is genetic. How is autism managed? Another question. How is autism managed? Behavioral therapy, speech therapy, occupational therapy, and parent training. The parents of these children are trained by the health educators on what to be doing and how to take this child to the next level. Parent training. And then we have special education programs that these children are trained. You know, when you start training them earlier, they start exciting centers of brain that can bring back the child. So don't assume these children. Some people hide them because they don't want to know they have autistic children. It's not good. There is another question. Can autism be prevented? Now, prevention has no guarantee, but risk may reduce. Good antenatal care, because if it is nutrition and micronutrients like folic acid, and in your family maybe you saw someone is autistic, so when you conceive, when you conceive, the first when you take the dipstick and you see you are pregnant, you go to hospital and you start folic acid for the development of the mitochondria and the DNAs in your. You can avoid getting a baby who is autistic, even if in your family the gene is there. So it's not guaranteed, but you can protect early when you find. And avoid alcohol and drugs in pregnancy, because they translate and translocate the DNAs, the differentiation. When the neural tube is being formed, the cells are migrating. Alcohol interfere, and alcohol interfere with absorption of nutrients. You get. Managing infection like toxoplasmosis and rubella, very important. When a mother is pregnant, be careful with infections. Be careful, because rubella interfere with the forming of the baby. Rubella interfere with the forming of the baby. If you have a question, guys, ask a question. Ask a question. Don't just listen. Come ask a question, at least to be on one page. What is the prognosis? What is the prognosis? What is the varies widely. Every child displays differently. Every child displays how prognosis. I think she meant how does it end up? You get, how does it end up? Every child displays differently according to the destruction of where the cells were destroyed. You get? So that one you cannot say that this one is better than this according to the staging. So it's severe, mild, or moderate. It depends with the staging. So these are the questions that, let me see others. Oh, we have other questions that are coming in. You see, nowadays people don't like posting here. They post on my email the question: do autistic people have normal intelligence? Some have average or high intelligence. I told you that when we started. Others may have intellectual disabilities depending on where the neural cells were destroyed. I think I'll come up with a lecture. Today I introduced how the normal baby and the cells go, they transported, and then they start forming limbs there. I'll come up with a special lecture of how embryology of the baby is, so that when people are relating to spectrum of diseases, they go and look at a video of a normal baby, how the arms, the cells that bring the brain, the eyes are. Now let's go. Do autistic people have normal intelligence? That one we have talked about. High. Some have very high, some have normal, and some have depleted. It depends with the staging. You get? Why do autistic children repeat behaviors? Repetitive behaviors. Why? Why do they repeat behaviors? Anxiety, provide comfort, and cope with sensory overload also. Sensory overload. You know, they are special children. Well, the questions are many today. If even you, when you are watching, if you have a question, please ask. Please ask. What is sensory sensitivity in autism? Sensory sensitivity. You may see some children, when the autistic children, when they hear a sound, they do this. Or when there is rain and it's so heavy, they do this. So they respond to sound, light, and touch. Or when you switch off the light, they respond. Autistic children. So they respond to these things. Okay, we see there is something else. Can autism affect adults? Yes. There are many adults who are diagnosed in childhood and they have struggled with it through until they are adults. We have seen many. Okay, and we have anyone with a question on the platform? These ones are the ones that I was sent when I started. There is one that I take that one, the last one. Anyone with a question? Sensory overload. Sensory overload. You know, when it comes to sensory overload, there are some things how can I put it in a normal language? This child has a brain that was malformed, and some cells are somewhere, and the interaction and the electric interaction of the brain is not normal. So sound, light, or touch can have an overload on how these children, I see many I'm picking some specific questions. Okay, I'll take that one. So when the cells migrate and the electric malfunction of the brain changes, it amplifies some things. You may talk to this baby in a low tone, but it amplifies, and then the child, you're talking to this child and this child is doing this, is hearing like you're making noise at this child. Or the light, the normal light, you feel like this child cannot, because the cells of the optic said hi, oh, Stan's Kitchen, welcome, I'm answering to questions concerning concerning autism. The cells that come from the optic nerve have been disturbed since conception. So they cannot perceive light in a normal way. You know, you perceive senses because of the cranial nerves. And we have 12 cranial nerves. So sensory overload means that at the point of the cranial nerve that is affected, it is exciting and amplifying the sensation. Optic, I'm looking. The light is so heavy, so when I'm looking, it is amplifying, so I cannot look. You see the child doing this, and sometimes crying, you get, and sometimes crying. And there is under sensitivity, seeking strong stimulation. I think that is what you are asking, Christine. Christine, I think that was what you are asking about sensory overload. The electric transmission of the brain and the cells that are destroyed during conception, they can amplify the sensor, the sense. The nerve that is being innervating can amplify the sense. Hearing sense, vestibulocochlear sense, that is cranial nerve number 8. Yes? That is cranial nerve number number 8, vestibulocochlear. The facial is number 7, vestibulocochlear. You check? So those are things. I think, Christine, that's where we are heading. These are, autism is the misplacement of the cells of the endoderm. And let me talk like a doctor. I am assuming that now you are a doctor or health practitioners. It's the misplacement of, where is that paper of mine? It's the misplacement of this. Please go to the other video I did today, you will understand this. Of ectoderm cells when they are migrating to form the neural tube inside, so that you can start forming the brain and the spinal cord. So when these cells of the ectoderm, they start migrating inside and they are disturbed, that is where we start forming autism. You get? So it starts from conception, where the fusion starts. So there is a question that is here, which is Christine Log. Have I talked about it well, or are you still having questions about the sensory stimulation? Now there is a question that I've been asked here that is a good question. What is the importance of early intervention? Improves communication, very important. Enhances social skills and reduces severity of symptoms. It improves communication and enhances social skills and reduces severity of the symptoms. You get? Now that you know that, anyone with any question, anyone, ask me a question on autism, or where you have not understand. Tomorrow we are dealing with diagnosis. We are dealing with how to diagnose autism. How can we diagnose autism? How can autism be diagnosed? That is another question. But what the point that I want you to take home is, autism does not start when the child is born. It starts from when conception is, life starts at conception. So when the sperm is flowing and then they meet at the ampulla of your uterus, they meet at the ampulla of, when you make love to your partner, when someone makes love to the partner or have sex, and then these sperms gets in, and then it comes up to the ampulla. When it is growing, you see, here, inside when it's going, it's forming something around the ball after it has entered, which is called a morula. You get? So when it's forming a morula, it comes here and forms something called a blastocyst. A blastocyst, you get? This guy is telling me I'm delusional. I think he's nuts, eh? Let me remove him so that he can, okay. Now, you see, this forms a morula, and then the morula starts to form cells as a ball of cells. That is between the first and the second week of conception. It comes and it goes inside. It attaches your cell into your uterus, and then when it is going to the uterus, when it has implanted inside the layers of the uterus, now they form layers. The cells that are formed, they form layers. These layers are ectoderm, mesoderm, and endoderm. So this is the process where autism starts. The structures of the ectoderm cells, they form something that is called the neural tube here. The neural tube is here. This neural tube is the problem now. Starts here. Tomorrow we'll see how stages of neural tube, and then we'll see the diagnosis. How these ectoderm cells are destroyed until a person can give birth to a baby who is autistic. And we have said the funny thing is autism does not start at birth, it is starting by conception. So all along you can be carrying a baby and that baby is autistic. Then when you give birth, after 6, 7, 8, 9, 10 months, then you come and realize you are having autistic child. Today's session has been short, but I want a question from, I think Christine Long had talked about sensory overload, and I answered that. Anyone who has any question? Anyone who has any question before I leave? Any question? Random question on anyone who has random question on autism? I leave. Or everyone is okay? Everyone is okay till we meet tomorrow. That was just, but we did something on autism. We did something on autism today. So if you have not seen it, please check. I'll talk about diagnosis tomorrow, but before I talk about diagnosis, I will talk about this step. I'll talk about this step after the blastocyst is implanted into the uterus. I'll talk about this step of forming the neural tube so that we can understand how autism comes, because this was the normal process. We need to talk about the complication now. So tomorrow we'll talk about the other step. Why an autism is so smart? Oh, it is so smart because if the cells of when the neural tube is migrating, let's say the cells of the brain of where the center of IQ were not destroyed, and this other side it was destroyed, and this child eating is a problem or movement is a problem, the high energies go to the center where the IQ is high, to the cells that were good formed. So you get this child has a high IQ and of intelligence than of normal person. Tomorrow when I'll be explaining about the migratory of the cells, I've just talked about how the ball is implanted into the uterus, and then how it forms. Welcome Queen CNLB, how it gets in. So there is something called the neural tube development. So tomorrow, before we see diagnosis, I will bring in that thing, what causes epilepsy. Can epilepsy be inherited? Yes, epilepsy is inherited. Many children that are autistic, they can get epilepsy. Remember, those cells are disrupted, and okay, thank you, makes sense. Yes, so remember, those cells are destroyed, and the normal electrical function of the brain is not working. Stan's kitchen. So this electrical function of the brain can cause nerve distortion, and then you get epilepsy. Another thing, epilepsy you can get when Of course, the nerve coordinating with the brain, but there is some conditions like epilepsy, like the normal seizures. When your fevers are high, when you have meningitis, infections can cause convulsive disorders. There is something else that can cause convulsive disorders like high BPs that injure the brain. Several things that can cause convulsive disorders. You get? Very many things, but most people that are epileptic, they can associate themselves with epilepsy because it is a brain that is injured. You get? Very many things that affect the brain can cause epilepsy. Epilepsy is not just one thing. You have seen children when fevers are going up, you get them convulsive. Imbalance of electrical supply and nerves in the brain. Yes. Stans, are you satisfied? Can we continue? So tomorrow, Alimig, at 4:30 when the talk will be there, if you have time, you will come to understand that question. There is something that is called the neural tube. When the bloody cells are implanted into the uterus, and then they start the protein signals, the ectoderm cells that are above, they start telling it, go inside now, we want to form a baby, and they migrate like this. You see my hand, this is a ball. So ectoderm migrate inside like this. So whatever that is inside here is called a neural tube. So there are centers where the neural tube begin to form the brain, and then the spinal cord, and then they come like this. They form the stomach, organs, the mesoderm. Mesoderm is the one that is in the middle. It forms the brain, the abdomen, it forms the hands, inside up to the kidneys, and then there is the endoderm, which forms the skin. You get? Oh yes, high fevers give seizures, but I know some people are just born with epileptic condition. Am I right? Yes, some people are born with epileptic condition because of the problem of the brain. Just as people are autistic children, some autistic children get convulsive disorders, epilepsy, because the brain was injured. So we will talk about epilepsy one day and you will see. Yes? Butterfly Island, high stands, that is from Alimik. Anyone with a question? 1 hour is already out, it's going out. Thank you so much for coming in. Is there anyone with any question? Anyone who is here and has a burning question before we meet tomorrow and talk about diagnosis and the neural tube formation. The neural tube formation is very important when it comes to epilepsy. So tonight or in the morning, know that epilepsy does not start when a child is born. It starts from conception and implantation of the uterus. You get? It can be genetic. Most of 75% of all are genetic. Others are lifestyle, alcohol, drugs, not going to the ANC clinics to take folic. You get? Nutrition. Whatever you take can bring problems to it comes from labor and delivery. No, it cannot come. Queen CNLB, when something hurts the brain when it is labor or delivery, it has already formed. That is a traumatic injury to the brain. It can form some things like encephalopathy, swelling of the brain. But a formed brain, you cannot injure inside where the nerves are uprooting and coming out. So it's totally different. Stan's Kitchen, thank you so much for that. Thank you so much for that. So let's learn, and if you have questions, always email me. I'll come live and always be telling me, Doc, talk about this. When I have time, I come and talk about them. Because I know even when I'm not live, some people Oh, okay, asking for a client. No. Just tell the client no, but you can listen. You can take Queen. You can let me share you this. You can forward that to her, to the client. If you can read, it will be okay. Let me check that link of today's video, where I was explaining how the neural cells come and how they depict themselves. No, where is this going? Oh, it's here. Okay, let me pin for you before I leave today's live. We talked about many things today that were so helpful. This one is yes, this one. I think this one will help embryology. So Queen, this whatever that let me the link that I'm sending you, you can forward to the person or anyone. This is what we did today, and it has explained so well about how the neural tube form and how epilepsy comes. So you can refer to that. Everyone who has watched, who is watched, and everywhere you are, be blessed. May God protect you, and may God be with you every time, and whatever you are thinking, may it be anointed by the blood of Jesus. Now, have a good day, a good night. I think I was just answering questions. If you didn't watch the video of today, I've posted there. Go through it and you'll learn a lot. Don't forget to share to people. These videos may help someone. Bye. Have a nice day, everyone.